This is One-on-One. We are pleased to be joined by Dr. Lukasz Partyka, who is Section Chief of Mammography, Healthcare Foundation of New Jersey Breast Health Center at Newark Beth Israel Medical Center. Good to see you, Doctor.
Very good to be here.
We're taping this program in mid-September 2015. In October 2015, this center is opening. Describe it and why it's so important.
Well, the center is important for many reasons. First and foremost, in our population in Newark, we do see a lot of advanced stage breast cancer, especially as compared with the national averages. So this is an important issue in Newark, in the greater Newark area. Also at Newark Beth Israel, we have seen our community outreach programs really increasing the utilization of mammography. Patients are starting to seek out that early detection of breast cancer. And so we got to a point where we were operating at approximately 95% capacity of where we were able to. Thanks to a generous donation from the New Jersey Healthcare Foundation, we were able to relocate our services to a new area. And the new breast center has many features that are an upgrade over our prior operation.
Help me on this. 3D mammography?
Correct.
What does that mean and why is it so important?
Okay, there's several reasons. First, I'll explain what exactly 3D mammography is. So your standard mammogram is a two-dimensional image, basically a single black and white picture. With a 3D mammogram, it's different for the radiologist interpreting. For the patient, it's basically the same process, okay? Except instead of a single image being taken, the X-ray tube that does the picture taking per se does about a 15-degree sweep, okay, and takes several low-dose images. Those images are then reconstructed by a computer, and this allows us to look at something we call a 3D image, which basically means we can go through the different breast tissues, sort of like paper-thin slices, looking at different sections of the breast in a sequential fashion. A lot of people liken this to sort of a flip book that you would see. A 2D mammogram would be like looking at just the cover of the book. 3D mammogram would allow you to actually flip through the pages of the book and see the different parts.
How does that help you in terms of diagnosis?
Well, it makes really a significant difference for two reasons. First and foremost, the normal breast tissues can sometimes get in the way of finding small invasive cancers. This is particularly problematic in women with dense breasts. So if you're doing a standard 2D mammogram, that cancer might be hidden by the normal tissues. However,
by the way, does everyone who come in get the 3D?
Yes. Actually, everyone, we move to screening everybody with 3D mammography.
That's unique.
Yes, it really is. Newark Beth Israel was one of the first adopters of this technology back in 2012. We initially only had one machine, so we were offering it on a sort of a diagnostic basis. Okay, if patients had problems and we needed to do the 3D mammogram to do additional evaluation. However, since that time, as part of opening this new breast center, we got a second tomosynthesis machine. That's sort of the technical term for 3D mammography. And since that time, we basically began offering screening to all of our patients. So everyone that comes in to get a screening mammogram at Newark Beth Israel has a mammogram with this technology.
And has the potential, once you have the diagnosis, that you may not otherwise be able to achieve with the two-dimensional picture, what potential impact, doctor, is there in terms of the protocol and the treatment?
Well, the impact is great because we know that survival after a diagnosis of breast cancer plummets once you're diagnosed with late-stage disease. And the beautiful thing about 3D mammography is that it allows us to detect these small invasive cancers significantly earlier than we would be able to with 2D mammography. We're talking about 30% increased cancer detection rate with 3D mammography over standard 2D, and that's a pretty significant number.
Describe the physical setting of the center. What is it like and why does that matter?
Well, when we were designing this center, in the process of looking at all the different elements of it, we really wanted to focus on the patient care aspect of it. So the center is designed to sort of get away from the typical hospital medical setting. Okay, we wanted this to be a really comforting setting for the patients. Being recalled for an abnormal finding on a mammogram is a high-stress situation for a woman. So we really wanted this to be patient-centered, to make this experience as easy as possible for our women coming in to have their additional evaluations. So we focused on making the atmosphere very gentle and spa-like and very comforting in the center.
It matters.
It matters a great deal.
The other thing that matters is the partnership with the Healthcare Foundation of New Jersey, and to fully disclose, the Healthcare Foundation is an underwriter of a lot of the healthcare programming that we do at the Caucus Educational Corporation, and they've supported much of what we've done. What is that partnership like?
Well, the partnership has been tremendous for Beth Israel, and in particular for our radiology department. The Healthcare Foundation was instrumental in getting this breast center opened, and without their generous donations, this would not be possible.
How did you get into this?
Well, I started out as a radiology resident, and radiology is a very, very broad specialty. I was fortunate to have really good mentors in the subspecialties relating to breast imaging. This was a part of radiology where you really get to make a difference. You meet with the patients, you speak with the patients. Sometimes radiologists, people think you just read x-rays. In the field of mammography, you're examining patients, you're doing ultrasounds, you're communicating with patients, you're having sometimes very sensitive discussions. There's a real humanistic aspect to it that kind of drew me towards that.
Well, listen, it is important work, and particularly in the city of Newark, where, to be very clear, women diagnosed with breast cancer, they're being diagnosed at a much higher rate than the national average. Correct. They're being diagnosed later, correct, which is problematic, because the sooner women are diagnosed, the better. They're being diagnosed younger, absolutely, problematic. Mm-hmm. And so this Healthcare Foundation of New Jersey Breast Center at Newark Beth Israel Medical Center is huge. And so, Doctor, I want to thank you for joining us and sharing the development of this. And as it continues to move forward, we'll keep talking about it. Thank you, Dr. Partyka.
Sounds great. Thank you for having me.
We'll be right back right after this. Thank you.
Thank you.